We all know the importance of health insurance. It's there to protect us, right? It's supposed to be our shield against the unexpected, a safeguard for our health and financial stability. Like a safety net, it promises peace of mind when illness strikes. We believe that with health insurance, we can face medical emergencies without the fear of financial ruin. We pay our premiums, trusting that the system will work when we need it most. Month after month, we invest in this promise, hoping it will be there for us in our time of need. But what happens when that promise is broken? When the system we rely on fails us, the consequences can be devastating. What happens when the very system designed to protect us becomes a source of stress and frustration? Instead of providing relief, it adds to our worries. The truth is, navigating the world of health insurance claims can be a nightmare. The process is often more complicated than it should be, leaving many feeling lost and helpless. It's a complex and often confusing process, filled with paperwork, jargon, and endless phone calls. Each step can feel like a hurdle, and every interaction can be a test of patience. And for many people, it can feel like an uphill battle against a faceless bureaucracy. The very system meant to support us can sometimes seem indifferent to our struggles, making the promise of health insurance feel like a distant dream. So, how does this process typically unfold? Let's break it down. First, you receive medical care. Whether it's a routine checkup or an unexpected emergency, you assume your insurance will cover it, at least partially. Then, the bills start rolling in. This is where the confusion often begins. You need to file a claim with your insurance company, providing detailed information about your medical services. This usually involves filling out lengthy forms, gathering medical records, and submitting everything within a specific time frame. It sounds straightforward enough, but the devil is in the details. One of the biggest challenges is simply understanding the language of health insurance. From deductibles and copays to out-of-network providers and pre-authorization, the terminology can be overwhelming. It's like learning a whole new language, and unfortunately, there's no phrasebook to guide you. This lack of clarity can lead to costly mistakes. You might unknowingly use an out-of-network doctor or miss a deadline for filing your claim. And even if you do everything right, there's no guarantee your claim will be approved. Real-life claims nightmares. I've heard countless stories from viewers who have faced unimaginable challenges with health insurance claims. These stories are not just numbers or statistics. They are real people with real struggles, facing the harsh reality of denied claims. One woman, a single mother battling cancer, had her claim for life-saving medication repeatedly denied. Despite her dire need, the insurance company refused to cover the costs, leaving her in a desperate situation. She spent countless hours on the phone, appealing the decision while her health deteriorated. Each call was met with resistance, and every appeal seemed to fall on deaf ears, adding to her stress and anxiety. Another viewer, a young man who suffered a severe injury in a car accident, was denied coverage for physical therapy. His road to recovery was already challenging, and the denial of his claim made it even more difficult. The insurance company argued that his treatment was not medically necessary, despite his doctor's recommendations. This left him in a painful limbo, unable to get the care he needed to heal properly. These are just two examples of the countless heartbreaking stories I've encountered. Each denied claim represents a person in distress, a family in turmoil, and a system that often seems indifferent to their plight. The emotional and financial toll is immense, and the fight for coverage can feel like an uphill battle with no end in sight. The emotional roller coaster of healthcare bureaucracy. The impact of these denials and delays goes far beyond financial strain. It's not just about the money, it's about the emotional and psychological toll it takes on individuals and families. It's about more than just money, it's about people's lives. The constant worry and uncertainty can be overwhelming, affecting every aspect of daily life. The stress and anxiety of dealing with health insurance claims can take a toll on your emotional and mental well-being. The endless phone calls, the confusing paperwork, and the feeling of helplessness can be incredibly draining. It's a system that often feels designed to wear you down, to make you give up. The bureaucracy can seem insurmountable, leaving you feeling isolated and defeated. But we can't give up. We must continue to advocate for change, to push for a system that truly serves the people. We need to keep fighting for a healthcare system that puts people first, one that prioritizes health and well-being over profit, a system that is fair, compassionate, and accessible to all. Together, we can make a difference and create a healthcare system that works for everyone.